Hello, everyone, and welcome to MyCHN podcast, Health Conversations Without Barriers. Thank you for joining us for day 3 of National Health Center Week. And today's title is Agricultural Worker Health. So sometimes, you pick up your fruit from the supermarket, HEB, Kroger, wherever you go. And sometimes you don't think about who has worked, who has toiled in the sun, drenching in sweat to get that fruit or that veggie. And today we're going to talk about the health of a very important group, our agricultural workers.
Yeah, so a lot of people don't know, but our agriculturals are migrant workers. So what does that tell you? They don't have access to healthcare. Most of them don't have access to healthcare, and it's very important. So agriculture is a huge part of our society. The food we were in some of the fabric we use together by agricultural workers. It is always important to remember that they are human and that they need access to healthcare, right? So I know in 1962, there's a Migrant Health Care Act signed by President John F. Kennedy, but it goes beyond that, right? So we don't think about how did we get this fruit? We just buy and eat, like Mariela said. However, they are migrant workers, and they do need that care. So, as CHN, MyCHN, what we do is we actually have programs that help those that don't have insurance or aren't able to get insurance, and we're able to see them at a lower cost. So this is something very important. However, we don't work with them directly because we're not in those areas. But I don't anticipate not being there in the future, right? Because we're growing so much,
Yeah.
and we're being part of all of that. So, but yes. So one of the things that questions it was in what ways do you think that we can better this community in terms of getting care to the workers and their families? Well, as MyCHN, we love the accessible care. So not only do we have different locations throughout Brazoria County, we have Galveston County and Southeast Harris County, but we also offer virtual care for those family members that aren't able to come to our clinics.
In their language.
In their language, of course, yes. So that's another very important part of it is not only do we just speak English, we have different languages to accommodate those patients that need those. We're going to meet those needs. And that's, I think, something very important that we do. And that's why we cater to the Agricultural Worker Health Day. So on that note, we will be volunteering for Harvest for Hungry here in Freeport. It's really exciting because there's another organization that does a lot for the community. What they do is they actually grow their own fruits and veggies, and they teach families, low-income families, how to pick their own fruits and how they're trying to do more like a healthy style of living as well. And so what we're going to do is we're going to volunteer, and we're going to help the Harvest for the Hungry for the day. So that's really exciting. I'm really excited about that.
So thank you for listening, and we'll be back for day 4 for Patient Appreciation Day.